We're going to make sure that something like this is not repeated, and that we are monitoring, supervising, overseeing in a much more aggressive way exactly what's taking place in Dallas initially, and making sure that the lessons learned are then transmitted to hospitals and clinics all across the country.
President Obama talking Wednesday about the Ebola crisis. Morning, everybody. I'm Simon Constable. We'll have an in-depth look at what authorities are doing to help stem the spread of the deadly disease. To help us with this, WHA Atlanta Bureau Chief Betsy McKay, who oversees the coverage of the Centers for Disease Control. Betsy, this story it seems to go from bad to worse. Thank you for joining us today. I know this is a lot of work for you. We've got a second healthcare worker who's got infected with this disease, and she told the CDC that she had a temperature, but was still allowed to fly. Did the CDC mess up here?
Well, yeah, it's a little complicated, but it is sort of shocking. Basically, what it comes down to is that according to international and CDC guidelines, the threshold for a fever for Ebola, when the alarm bells go off, is 101.5. This healthcare worker apparently called called the CDC before she got on the flight and said she had a temperature of 99.5, and she was not told not to get on the plane. So technically that was following the guidelines. But of course, it's kind of surprising that they would tell a healthcare worker they knew had been in contact with an Ebola patient that a temperature of 99.5 was not, somehow concerning.
Well, it is a little concerning, and then we're hearing reports unconfirmed at this stage about the training in Texas Presbyterian not being really up to snuff. This isn't really something that most healthcare workers are trained to do. It's not like giving an injection or taking a temperature, is it?
No, it's not. And there are a lot of allegations about that. The nurses say that. Or the nurses union says that some of them had exposed skin. In some cases, the CDC guidelines say exposed skin is okay. That's maybe something that needs to be revisited. The government is looking into some of these allegations to see what really happened. But what the CDC has said is that it looks like in the first couple of days when Mr. Duncan was in the hospital before he was formally diagnosed with Ebola, before the CDC sent a crew down, they were using different forms of protective gear, and very often too much protective gear, so that they were putting themselves in danger when they were taking the contaminated equipment off.
Yeah, and that equipment it's very bulky and stuff. It looks almost like a diving suit in some ways. Now, one thing that I've heard is people say that, look, the actual vectors as of the way this thing is going to get around could be through the healthcare workers. Is it worth saying that the healthcare workers who are engaged in treating Ebola patients be told not to travel at all? And so basically, you have to stay, if you're in Dallas and you're treating healthcare workers, should you have to stay in Dallas until this is all eradicated?
Yeah, and that's essentially what they told these healthcare workers. This healthcare worker, this nurse, was actually out of town when that order came down. And so exactly what she was told, we don't know. But definitely, there needs to be a lot of action on this front. People who are exposed should not be traveling around. Some have even raised the question of whether they should be quarantined. People who aren't sick normally aren't quarantined. So you get questions of civil liberties versus public safety coursing through here.
Okay, and Betsy McKay saying there something needs to be done, and quickly. Thank you very much, Betsy McKay of the Wall Street Journal.